and coaches. Doctors are seeing a surge in serious knee injuries among young basketball players this winter. Injuries so severe they almost always require surgery. In just the last 3 months, specialists say they've treated nearly a year's worth of specific fracture affecting the growth plate in the knee, mostly in boys ages 12 to 16. Joining us now is orthopedic sports medicine surgeon Dr. Emily New of Children's National Hospital to break down what is happening and what families can do right now to reduce this risk. So, doctor, first off, exactly what is this injury and why are you guys seeing such a spike right now, especially during this basketball season?
Thank you for having me. Yes, so the fracture is called a tibial tubercle avulsion fracture, and it involves the growth plate at the top of the shin bone at the knee. And basically, the fracture goes through the growth plate, across the basically top of the shin bone, um, and it occurs when there is a contraction of the quad that's sudden. So oftentimes it happens during a jump in basketball, which is why it's seen so frequently in basketball. And because of this, your entire quad muscle, your kneecap, your patella, and your patella tendon are basically like not connected to the bone anymore. And that is why it most frequently requires surgery.
You know, basketball is a popular sport, but then why are we seeing it most at risk for boys ages 12 to 16?
That's the age group when that growth plate is just starting to close, but is still largely open. And that's also the age group when I think kids are starting to get more serious about basketball. Maybe there's an increase in their level of play or how much time they're spending playing basketball. We think that that's why it's correlated so closely with that age group.
You said earlier that it almost always requires surgery. What does that actually look like, and what does recovery look like, especially for these kids?
Mhm. So the surgery is basically making an opening where that fracture is, and then putting the fracture back into place, and then holding it in place with screws. So it is a longer recovery because of that. You need the bone to heal, and then the patient needs to regain their strength. So I would say typically it takes up to about 6 months, even a year, before they're back to playing basketball.
All right, so you may have a parent watching this. They have their kid playing basketball. They don't want to remove them from that sport. What should they know? What's your advice to them? And is there anything that they could already start doing right now?
hmm we think that most of these kids already have some signs before the fracture happens of something going on at that growth plate. So in kids this age, there's inflammation that can occur in the growth plate. It's called Osgood-Schlatter. So basically, that bump at the front of your knee, right at the top of your shin bone, that's called the tibial tubercle. A lot of the time, basketball players in this age group will get pain right in that area. When they get pain in that area, that's a good sign that they should take a break. They should wait for the pain to go away before resuming basketball. Other general things are just making sure that you're stretched out and warmed up before playing. And then also making sure not to overuse the knee. So basically making sure that there are breaks during the week, and that there are breaks between seasons, so that these adolescents are not at increased risk for this type of injury.
Frankly, it almost sounds like a life lesson for all of us. Take a break when you can. Dr. New with Children's National Hospital, thank you so much.
Thank you.
This W